Hello, I'm Yvette Torres. Welcome and thank you for joining us for National Recovery Month, a celebration that takes place every year in September. The National Recovery Month observance celebrates people in recovery, raises our awareness and understanding of mental and substance use disorders, and recognizes those who work in the field of behavioral health. The 2017 theme, Join the Voices for Recovery, Strengthen Families and Communities, encourages communities across the nation to include and support people in recovery. People in recovery want to and do participate in their communities through meaningful daily activities such as work, volunteerism, family caretaking, and creative endeavors. Recovery Month provides an opportunity for people to speak about the gains made by individuals in recovery. Sharing these success stories with neighbors, friends, and colleagues helps to increase awareness and furthers a greater understanding about behavioral health conditions. Sometimes people in recovery face challenges as they strive to live self-directed lives and achieve their full potential. For example, geographical distance can be an issue when people who live in rural and frontier communities try to access treatment and recovery supports. We know that these communities can show a great creativity and resourcefulness to help those with behavioral health conditions by including a wide range of professionals, programs, and technologies when providing services. Acceptance and support in the community can be a very important part of generating opportunities for independence, income, and resources to engage in society. For many people, community-based organizations, including faith-based groups, play a vital role in helping them to find their own unique path to recovery. Such organizations offer opportunities for people in recovery to make social connections with others who value their experiences and abilities without discrimination. Telling their stories and describing how their communities included them and the impact they have had on their lives and how they have subsequently given back to others are very powerful. Sharing their recovery journeys in the community shows others who are experiencing a mental health condition or a substance use disorder, or both, that they are not alone and that recovery is possible. For more than 25 years, Recovery Month has educated Americans about the facts. Nearly 1 in 10 Americans struggle with a substance use disorder, and about 1 in 5 have a mental health condition. No individual and no community is immune to these disorders and their effects. National Recovery Month also lauds the contribution of treatment and service providers in the recovery process. Because the impact of mental and substance use disorders is community-wide, many different professionals are now involved in helping people start and continue on a recovery journey. First responders, criminal justice professionals, law enforcement officers, and public health specialists often help link people with behavioral health conditions to the services they need to support recovery. We recognize their efforts as well as those of treatment and service providers who work in more traditional settings. Recovery Month sends a critical message. Mental health services, treatment for substance use disorders, and recovery support services can enable those with these conditions to lead healthy, rewarding, and productive lives. It is important for all communities to offer these in a way that includes and socially integrates all their members. The benefits of recovery extend beyond the individual, as families and communities are better off when as many people as possible live self-directed lives and achieve their full potential. By taking part in Recovery Month events, you can engage with others in supporting those in recovery or assist in helping those in need of treatment get the help they need to overcome mental and substance use disorders. By hosting activities and events in September, you can help spur conversations about prevention, treatment, and recovery services for behavioral health conditions. Such conversations, particularly describing what communities can do to include and support people in recovery, can really bring home to elected and appointed officials, civic leaders, business leaders, and other community leaders the gains and cost savings that can be achieved through the availability of mental and substance use disorder services.
Good morning, everyone, and welcome to Samsa's 27th annual Recovery Month observance. This year, we're asking everyone to join the Voices of Recovery, and our theme this year is Our Families, Our Stories, Our Recovery, because we know that families play an important role in people's recovery. Recovery Month provides an opportunity to celebrate those Americans in recovery from substance use disorders and or mental illness. It also celebrates the hard work, the day-to-day work of dedicated professionals in the field, of advocates, of grassroots organizations, and of the family members and friends who have joined their loved one on this unique journey of recovery. Today, Samsa is releasing a national report, Behavioral Health Trends in the United States, results from the 2015 National Survey on Drug Use and Health.
Millions of Americans are affected by mental and substance use disorders each year, and millions, in fact, most, go without the treatment that could help them achieve recovery. Nearly 55 million Americans, 54.9 million Americans, or 1 in 5 adults in America met the criteria for a substance use disorder or a mental illness in the past year, and only 39% of that 55 million received services.
One of the guiding principles of our National Drug Control Strategy is that it's based on science and driven by data. And I think it's really important that while we have made some significant progress in a whole host of issues, I want to highlight kind of one area that Kana talked about that needs dire attention. And that is really, despite all of our efforts of the Affordable Care Act and the parity law and the resources that the Obama administration has put in to increase access to treatment, we know that too many people are not getting treatment for the care of their substance use disorder. I, like Kana, find it incredibly moving and motivating that we need to increase the capacity of those people who are getting care and treatment. Expanding access to treatment means more people will reach recovery and be able to forge healthier lives.
Recovery Month reminds us that there is hope, that through evidence-based treatment and services, that there is hope for a better tomorrow for the millions of Americans who experience behavioral health conditions in their families. We know, in fact, that every American with mental illness and substance use disorders can improve, and most can and do recover. And I know this personally because I am one of those individuals having lived with mental health and addiction conditions for most of my life. Throughout my personal journey of recovery, and with the support of my family and community and sharing my story, I have joined the Voices of Recovery, and you can too.
For over 2 decades, Samsa's Center for Substance Abuse Treatment, CSAT, has played a vital role in the successful treatment and sustained recovery of millions of Americans who are now living healthy and productive lives. They're supporting their families, they're building their communities, and they're contributing to the well-being of this country. CSAT-funded programs are focused on screening for substance use disorders in a variety of settings, increasing access to treatment and recovery supports for people who have substance use disorders, and ensuring that the care that people get is of quality. We closely monitor and evaluate the services we fund and those for which we have regulatory responsibility. Performance outcome measures from these evaluations indicate that our programs are improving health outcomes, they are increasing housing, employment, and education for people with substance use disorders, and they are reducing criminal justice involvement.
I grew up in a time where it was real popular to do drugs. In the late 60s and 70s, there were stores all over the place. You could go buy cocaine spoons. It was just so popular. A lot of my friends went to Vietnam, and when they came back, they were addicted, my husband in particular. So when he came back from Vietnam, he wasn't there very long, but he was hurt. And he saw things that I don't think any 20-year-old is supposed to see. So when he got back, he was addicted. He was already addicted to heroin. So I was introduced to heroin, and I liked it. What helped me is methadone. There's nothing wrong with methadone. Methadone saved my life, gave me my life back, gave me another career. And if we could take the stigma off of methadone, and any medication that would assist somebody to their recovery, they can sustain their lives and they can become productive, self-sufficient people. And the thing that I know is recovery services. Treatment is important because you need that, but it was the recovery services that saved my life and the reason why I'm standing here. Thank you. Thank you.
My story is yours. I am a mother.
I'm a father, a son,
A daughter. I am in recovery from a mental illness.
a substance use disorder.
With support from family and community,
We are victorious.
Join the Voices for Recovery. Our families, our stories, our recovery.
For confidential information on mental and substance use disorders, including prevention and treatment referral for you or someone you know, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
Thank you so much for honoring us by your presence here today to help us celebrate the 27th National Recovery Month luncheon. We've always been concerned about education and prevention and intervention and treatment and recovery and all of the continuum. And we've always believed that it's only all of us working together can we really achieve progress, and most importantly, continue and sustain that progress. And that's really what recovery is all about.
In the area of prevention, it's about a lot of things when it comes to opioids. It's about making sure that physicians understand and appreciate when and under what circumstances, as limited as they need to be, opioids should be prescribed. So CDC's come out with new guidelines, basically setting the parameters and the borders. These are the boundaries. These are the questions that you should ask. These are the options you should consider before you make that decision to provide a patient with opioids. And when you do, when it is appropriate, when it is necessary, make sure that the number of prescribed pills meets the need, that you don't overprescribe. And recently, we announced additional resources from HHS. That's been a great partner with Michael's shop and with our shop at USDA, with FDA. Folks have been engaged in this in a very collaborative way. So they put more resources out. Earlier in the year, we put out roughly $94 million that helped to expand access to 271 clinics, expand the access or create 271 new locations, if you will, for help. You know, recovery is incredibly important because you can have all the prevention in the world and all the treatment in the world, but you also have to have the capacity to have a community that supports you every single minute of every single day for the rest of your life.
We started on a journey today, but this journey will not be complete until we ensure that everyone who has a substance use disorder can come forward and does not have to live in shame. Our journey doesn't end until everyone who needs treatment can actually get it. Our journey doesn't end until we ensure that as a country, we are coming together to value each and every life. And our journey doesn't end until hope replaces despair, until love ultimately overcomes fear. That's the journey that we're on. And I want to tell you that as your Surgeon General, as a fellow citizen of America, as a resident of this planet, I could not be more proud to stand with you, shoulder to shoulder, on every step of this journey. So thank you all so much for everything you have done. I appreciate you.
Recovery to me means living a normal life, being able to live the life the way I want to live it, and not having anyone saying, well, you know, you have a mental illness, you can't do that. and not having medications control my life. But being able to have that conversation with my doctor and being able to say, this works for me. Not having a pill forced on me, but having joint choices made. And the peers gave me the hope and understanding of what recovery meant. Being able to communicate with others who lived the same experience that I was going through, wow, I never had that connection. Someone who knew what I was going through.
Recovery means to me today, living fully, being well, being happy, dancing in the rain when the storms keep coming, because life happens. And I am somebody, and I have choice, and I have power today. And recovery is about letting people know my story and not being afraid.
I just got to a place of hopelessness in my own addiction, a place to where I couldn't really go on anymore, to where my only option was either death or just living in that constant death. And so I made a choice, in a sense, to give my will over and to try a new way of life and to surrender. And since then, exponentially better. Been in recovery for a little over 14 years, and my life is beyond what I could have even imagined at that time.
My family and friends are always with me, no matter where I may be. Sharing stories from home helps me sustain my recovery from my mental and substance use disorder.
Hi, sweetheart.
Join the Voices for Recovery, our families, our stories, our recovery.
For confidential information on mental and substance use disorders, including prevention and treatment referral for you or someone you know, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
Recovery events took place across the globe in September as tens of thousands gathered in local communities to celebrate the courage, the strength, and the support that have helped so many experience firsthand that recovery is possible, that recovery can and does happen, and there is joy in recovery. September 10th was the date of the McShin Foundation's 12th Annual Recovery Fest and 7th Annual KCBS Barbecue Cook-Off. The cook-off started out as a way to help people in recovery at McShin have a little fun and spread the message of smoke meat, not drugs.
And we have used this day to really expand the recovery movement in Virginia. Each year the event gets a little bit bigger, more people come, and we feel like anybody who's trying to get the word out about recovery, use this event to showcase what you do, but even more importantly, to let people know that recovery happens.
Not only just fun and recovery, but it's a family event that our people can bring their kids and their family members to, to show them like they can have fun in recovery and to start healing those families back together. That's why we have these events. We go to so many funerals, we're kind of over it. It's a lot, and the kids are getting younger and younger, that are dying from this disease. So that's kind of in a nutshell we do. Smoking meat, not drugs, that's our thing.
You got people coming out here, they don't know anything about addiction. They don't know that it affects you in so many different aspects and areas of your life. And it's just awesome being able to cook a little barbecue, hang out with your friends, inform people about the disease of addiction if they don't know anything about it.
The event also featured speakers who delivered some encouraging news about federal support for the recovery movement.
We're going to do the first ever Surgeon General's report on addiction, drugs, alcohol, drugs, and health. It's going to be the first time that we take a scientific look on the neurobiology of substance use, on prevention, treatment, recovery, and financing, and understanding, putting all the science in one place to say this is a real brain disease. This is something from which people can recover and from which people also can have a recurrence, and we need to make sure that those recovery support services are out there.
And no one symbolizes the importance of that treatment and support more than those who are in recovery.
The McShin Foundation and McShin Academy created this environment for me where there's other kids that are open about their feelings and want to get better. Because a lot of kids really do need this place. They just don't want to be honest with themselves and confront the fact that they do have a problem.
Recovery is not easy, but it is worth it. Nothing happens overnight, but today I'm willing to work for the good things in life instead of trying to substitute and find an answer through an easy fix through drugs or alcohol.
The recovery movement runs the gamut from barbecue to books. An event in Austin, Indiana, focused on a book called Dreamland by Sam Quinones, who traces the history of the opiate epidemic sweeping through small-town America.
Doctors began to buy the idea in the mid-1990s that they should prescribe opiate painkillers for all manner of pain and in large doses and in unending prescriptions sometimes. And that this was had created lots of addiction, and that a lot of those addicts were transitioning by the mid-2000s, late 2009, 10, 11, to heroin, and that was accelerating. And I felt that that was a national story that no one had told yet.
I can remember, first coming off of my pain medications thinking, how am I going to live? Because I had been treating chronic pain for years and followed the medical establishment's thought processes on that. And when we found those were all wrong, it was very scary. But the reality for me is being able to say, hey, you know what? Not only is your pain going to get better off of all this stuff, you're going to have a better life if you immerse yourself into this recovery lifestyle.
The event also included the release by Samsa of 2 new PSAs on addiction treatment and education, which were filmed in the local community. The PSAs will eventually be used throughout Indiana and neighboring Ohio and Kentucky.
The addiction took me to living in the streets, not knowing where I was going to stay at or who I was going to stay with, and if I was going to be found in an alley. That was my mother's greatest fear. And my family, is that they were going to see me or an unknown female in the Louisville area found in an alley.
Recovery is such a better way of life. I know the pain and the suffering that people with the substance use disorder go through, having been there myself, been in that hell, and it is hell.
Accidental overdose is the leading cause of accidental death today in the United States. And being a survivor of overdoses myself, I really want to get the message out there that there is hope, that there is a solution, and that we need to start talking about that solution more.
This year's Recovery Month events culminated on October 2nd with the Big Texas Rally. People from coast to coast gathered with a common goal to celebrate recovery and to encourage people in recovery to freely share their stories, to open a national dialogue about recovery, and overcome the stigma associated with substance use and abuse.
Allow us to show the world that prevention works, treatment is effective, and indeed, recovery is possible.
My story is not unique, that I am just one of millions of Americans in recovery who've gone on to live long and productive lives, just like all of you. So it is so important. It is so important that all of you are here today. I can't tell you how critically important it is to show this community, this state, this nation that recovery is possible, that we can and deserve care, that addiction is not a disgrace, it's a disease, and that we deserve good care and good treatment for what we're trying to do.
We've united across the nation to come together to support and celebrate the idea that recovery works, treatment is effective, prevention is possible, and to come together to show the world that we're not hidden in church basements, that we're not hidden in any other parts of the country, that we can be out in the open, and showing the world that this whole thing, this whole rally, this whole community is important.
So being in recovery is a big asset to me. It is very important to me that I do this so my loved ones, my friends, my next door neighbor, person across the street that's down on the corner can see a difference in me, because guess what? When you're clean, it shows. You just glow. I mean, you just stand out like a sore thumb.
Recovery means healing. It means freedom. It means freedom from addiction. It means being on that other side. It just means an opportunity to live a natural, joyful, stable life, something that you're not able to do when you're in addiction.
I salute each of you today that are in recovery. We know we could not do it without you. We are better together.
That it takes the whole family. It's just not the one person, but it is the family, the spouses, children, that we're all in recovery, and recovery is good for our minds, for our families, and for our hope and future.
Yes.
Thank you. Recovery is good all the time. And all the time, recovery is good.
The events showcased truly represent the passion and the spirit, enthusiasm, and support found in each and every recovery event across the nation and around the world.
For more information on National Recovery Month, to find out how to get involved or to locate an event near you, visit the Recovery Month website at recoverymonth.gov.
No person is an island, as the saying goes. Everyone wants to participate and be welcomed by families, organizations, and institutions that make up a community. The stories of people in recovery are the stories of our own family members, our friends, our neighbors, and our co-workers. These stories, although quite diverse, all take place in the context of a community. Millions of people are in recovery in every community throughout the nation, but many more have yet to find their path to living self-directed lives and achieving their full potential. Sharing stories of recovery, realizing the valuable role that communities play in our journey, and recognizing the contributions we all make in our communities encourages others to seek treatment and find their own path to recovery. You can be an agent for positive change to help people from all walks of life on their own unique path to recovery. I hope that this show inspires you to get involved and to organize a Recovery Month event for September. For information on how to get started, go to the Recovery Month website at recoverymonth.gov. There you will find examples of events others have organized and information on planning an event and fundraising ideas. When you visit the site, you'll see that participants have been inspired to organize events that reflect their own unique imaginations. We look forward to highlighting your 2017 Recovery Month event in our next showcase of events. The Substance Abuse and Mental Health Services Administration thanks you for all you do to support recovery. Let's keep this exciting work going.
To watch this program or other programs in the Road to Recovery series, visit the website at recoverymonth.gov.